Diabetes is a chronic medical condition characterized by elevated levels of glucose, sugar, in the blood. This occurs either because the body does not produce enough insulin, or because the insulin it does produce is not used effectively. Insulin is a hormone produced by the pancreas that regulates blood sugar levels by facilitating the uptake of glucose into cells for energy. There are several types of diabetes, each with its own causes, risk factors, and management strategies. The most common forms are type 1, type 2, and gestational diabetes. Understanding these types, their implications, and how to manage them effectively is crucial for maintaining health and quality of life. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This results in little to no insulin production. Often develops in childhood or adolescence, but it can occur at any age. Requires lifelong insulin therapy, which can be administered through injections or an insulin pump. Monitoring blood glucose levels is essential, as is adjusting insulin doses based on food intake, physical activity, and stress levels. Type 2 diabetes occurs when the body becomes resistant to insulin or when the pancreas does not produce enough insulin. This form of diabetes is often linked to lifestyle factors and genetic predisposition. Typically develops in adults over the age of 45, but increasing numbers of children and adolescents are being diagnosed due to rising obesity rates. Initially managed with lifestyle changes such as diet and exercise. Medications may be prescribed if lifestyle modifications are insufficient. Insulin therapy may be required in advanced stages. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet the increased needs, leading to elevated blood glucose levels. Typically diagnosed in the second or third trimester of pregnancy. Managed through dietary changes, exercise, and blood glucose monitoring. In some cases, insulin or oral medications may be necessary. Gestational diabetes usually resolves after delivery, but women who have had it are at higher risk of developing type 2 diabetes later in life. A rare form resulting from a single gene mutation. Examples include neonatal diabetes and maturity-onset diabetes of the young, MODY. Occurs due to other medical conditions or treatments, such as chronic pancreatitis or long-term use of certain medications like corticosteroids. A family history of diabetes increases the risk of developing the condition. In type 1 diabetes, autoimmune reactions lead to the destruction of insulin-producing cells. In type 2 diabetes, cells become less responsive to insulin, leading to high blood glucose levels. Hormonal changes during pregnancy can lead to gestational diabetes. Family history, genetic predisposition, and autoimmune disorders. Obesity, physical inactivity, poor diet, age, family history, ethnicity. Higher risk in African American, Hispanic, and Asian populations, and metabolic syndrome. Overweight, age, older mothers are at higher risk, family history, and having had gestational diabetes in a previous pregnancy. Frequent urination, excessive thirst, unexplained weight loss, fatigue, blurred vision, and slow healing sores or infections. Symptoms often develop rapidly over a few weeks. Symptoms develop more gradually and can be subtle, making it harder to detect early. Often asymptomatic but may cause excessive thirst and frequent urination. Measures blood sugar levels after fasting for at least 8 hours. A fasting level of 126 mg per deciliter or higher indicates diabetes. Measures blood glucose levels after fasting and 2 hours after consuming a glucose-rich drink. A 2-hour level of 200 mg per deciliter or higher indicates diabetes. Reflects average blood glucose levels over the past 2-3 months. An A1C level of 6.5% or higher indicates diabetes. Measures blood glucose at any time of day. A level of 200 mg per deciliter or higher suggests diabetes, especially if accompanied by symptoms. Essential for managing blood glucose levels. Includes various types of insulin, rapid-acting, long-acting, and delivery methods, injections or pumps. Regular monitoring to adjust insulin doses and manage blood sugar levels effectively. Balanced diet and regular physical activity are crucial for managing blood glucose levels. Initial management often focuses on improving diet, increasing physical activity, and achieving a healthy weight. Oral medications or injectable drugs may be prescribed to help manage blood glucose levels. May be required if oral medications are insufficient. Regular blood glucose monitoring to track progress and adjust treatment as needed. Focus on a balanced diet and regular physical activity to manage blood glucose levels. Frequent blood glucose checks to ensure levels remain within target ranges. Insulin or oral medications may be prescribed if lifestyle changes are not enough. Understanding diabetes, its effects, and management strategies is crucial for effective self-care. Engaging with healthcare providers, diabetes educators, and support groups can provide valuable guidance and encouragement. Regular checkups, eye exams, and foot care are essential to prevent complications and maintain overall health. Hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, can occur if diabetes is not well managed. Chronic high blood sugar can lead to serious complications, including cardiovascular disease, neuropathy, nephropathy, retinopathy, and increased risk of infections. Managing diabetes can be challenging and may impact mental health. It's important to seek support, engage in stress-relieving activities, and maintain a positive outlook. Adopting a healthy lifestyle that includes balanced nutrition, regular physical activity, and adequate sleep can improve overall health and well-being. Staying informed about new treatments, technologies, and research can offer additional options for managing diabetes effectively. Diabetes is a multifaceted condition that requires a comprehensive approach to management. Understanding the different types, recognizing symptoms, and adhering to treatment plans are essential for maintaining health and preventing complications. By adopting a proactive and informed approach to diabetes management, individuals can lead healthy, fulfilling lives while effectively managing their condition. Educating yourself, working closely with healthcare providers, and making informed lifestyle choices are key to navigating the challenges of diabetes. Remember that managing diabetes is a continuous journey that involves both physical and emotional dimensions. With dedication and support, you can achieve a balanced and healthy life, despite the challenges that diabetes may present. Diabetes is a complex and multifaceted condition that profoundly impacts millions of individuals worldwide. Whether it manifests as type 1, type 2, or gestational diabetes, understanding the intricacies of this disease and its management is crucial for maintaining optimal health and enhancing quality of life. As we conclude this comprehensive guide, it's essential to reflect on the key takeaways and the broader implications for individuals living with diabetes. Managing diabetes is a dynamic process that requires a well-rounded approach. For those with type 1 diabetes, consistent insulin therapy, rigorous blood glucose monitoring, and careful attention to diet and exercise are vital. Type 2 diabetes, often linked to lifestyle factors, requires a commitment to healthier living through dietary adjustments, physical activity, and, when necessary, medication. Gestational diabetes, though typically temporary, necessitates careful management to ensure a healthy pregnancy and reduce future risk. The overarching principle in all cases is that diabetes management is not a one-size-fits-all endeavor but rather a personalized approach tailored to each individual's unique needs and circumstances. One of the most powerful tools in diabetes management is education. Understanding the nature of the disease, its symptoms, and its potential complications empowers individuals to take proactive steps in their care. Education extends beyond the individual to families and communities, fostering a supportive environment that can significantly impact diabetes management. Being well informed about the condition, treatment options, and emerging research enables individuals to make informed decisions and actively participate in their health care. Integrating healthy habits into daily life is a cornerstone of effective diabetes management. This includes adopting a balanced diet rich in whole foods, engaging in regular physical activity, and maintaining a consistent sleep schedule. Lifestyle changes not only help in managing blood glucose levels but also contribute to overall well-being. It's important to approach these changes with patience and flexibility, recognizing that gradual, sustainable modifications are often more successful than drastic, short-term alterations. Living with diabetes can be emotionally challenging. The constant need to monitor blood glucose levels, adhere to medication regimens, and manage lifestyle changes can lead to stress, anxiety, and burnout. Addressing these emotional aspects is as crucial as managing the physical components of the disease. Support from healthcare professionals, mental health resources, and support groups can provide essential emotional support and help individuals navigate the psychological challenges of diabetes. Embracing stress management techniques, such as mindfulness, relaxation exercises, and positive reinforcement, can also be beneficial. Regular monitoring and preventive care are integral to managing diabetes effectively. Routine checkups, screenings for complications, and continuous blood glucose monitoring help in early detection and intervention. Preventive care extends to managing risk factors such as hypertension and cholesterol, which can exacerbate diabetes-related complications. By staying vigilant and proactive in preventive measures, individuals can reduce the risk of severe complications and maintain a higher quality of life. The field of diabetes research is constantly evolving, with ongoing advancements in treatment and technology. Innovations such as continuous glucose monitors, insulin pumps, and new pharmacological therapies offer new avenues for managing diabetes more effectively. Staying informed about these advancements and discussing them with healthcare providers can provide access to the latest tools and strategies for managing the condition. Ultimately, managing diabetes is about empowerment and self-care. It involves taking ownership of one's health, making informed choices, and advocating for one's needs. Building a supportive network of healthcare providers, family, and friends, while actively participating in care decisions, enhances the ability to manage diabetes effectively. Self-care also means being kind to oneself, recognizing that diabetes management is an ongoing journey with both successes and challenges. Diabetes, in all its forms, demands a comprehensive, informed, and proactive approach to management. By understanding the disease, embracing a healthy lifestyle, addressing emotional and psychological aspects, and staying engaged with preventive care and research advancements, individuals can navigate the complexities of diabetes with resilience and confidence. This holistic approach not only helps in managing the condition effectively but also in leading a fulfilling, balanced life. As we reflect on the journey of managing diabetes, it's important to remember that while the path may be challenging, it is also filled with opportunities for growth, empowerment, and improved well-being. With commitment, support, and the right tools, individuals with diabetes can achieve their health goals and live life to its fullest potential.